Okay, true believers, time to do another update, and this is with Hero's MRI results. I mean, we got a copy of the MRI, and I used to read a lot of these MRIs a long time ago, so I'm a little familiar with them. I so I've I've seen a few knees, so I know enough to be able to interpret a few of these. So here's like the frontal view, and this is the top view. What we're what we're really concerned with is the side view. But before we get into that, 2 months ago, Hero injured his left knee. He collided with another player. I know you're saying like Hero's a pretty big guy. How did this happen? Well, there's always a bigger person. So the person he ran into is like taller than him. I think he's about 6'1" or 6'2". Hero was about 165, 170 pounds at the time. And that person clearly is probably 200, 250 pounds. So he's clearly had at least 30, 40 pounds over him. So based on the physics, he was going to get the shorter end of that collision. So I I was concerned at first he didn't get up, and I was just we were just thinking it might be a sprain because he was able to hobble out of there, and I wasn't thinking that it was serious like an ACL injury. And I couldn't really test it out because he was guarding it. It was pretty sore, and but then I started suspecting something else was wrong because it wasn't healing properly. After a month and a half, it was still unstable. So that's when I started doing the anterior drawer test and the Lockman test. And I didn't like what I was seeing. So I went in and we decided to get an MRI to confirm our concerns. So here are the results. So I'm not gonna focus too much on the top view or the frontal view. What we wanted to look at is the side view. I what you want to do is okay. So here's Hero's MRI. This is the side view. So this is the femur or thigh bone. This is the tibia, shin bone, and here's his patella to kind of orient you. And we're looking at it from the side. And this is his knee joint. And what you want to look at is probably the best view over here to see his ACL. But I wanted to show you here first what you want to look at, the structure that you want to compare it to. This, you see this nice dark, very clear band right there, that's his PCL, and the PCL and the ACL cross each other. So if you see that, they're like hugging each other, and if you're seeing that, then you should be able to see the ACL also. And what makes this PCL nice is like what MRI shows you is a different density. So this shows the PCL, how we see how it's dense because it's got a lot of fluid, and it's got blood supply running through him. I'm lost for words here. So it's got a clear blood supply going in. So if you look over here and you get to see clearer in the ACL, this is the ACL supposed to cross it like this. And as you can see, his ACL is not dark at all like the PCL, where there's a blood supply going through it, where the density, like it's very dense because it's got blood supply and it's healthy. So you can clearly see that that's a healthy ligament right there. And over here, you can see it's all washed out and white, and then there's like some dark spots here and there. That means this confirms that his ACL has been completely obliterated right there. Normally you would see a nice, steep, angled black line going here between the femur and the tibia. Well, over here it's not. You don't have it because the MRI confirms that his ACL has been torn, a complete tear of his ACL. I mean, I didn't suspect it right away. I was in denial because when he came home, there was no swelling. He slept fine. When I had my ACL torn, I was in so much pain, but then I tore my meniscus also. It's just the ACL. If you look at the meniscus looks pretty normal to me. But as you could see over here, this is probably the clearest, where you could see it's just completely washed out. So he's gonna need ACL reconstruction. And the the sad thing is we only have Phil Health, which I don't know how much, if any, of that's gonna cover, because it's not an emergency. Phil Health's only for emergency. Well, this is more of an elective surgery. So, and from what I hear, or from what I've initially researched, here in the Philippines, they cost anywhere between $3,000 to $6,000 to $7,000. Is it still cheaper than in America, which is like over $10,000? Yeah, but over there, if you have insurance, and if you don't have insurance, then you can still get it done. It depends on where you go, but that's another added expense. As I don't have a lot of reserve expense, but I mean, we have to do what we have to do, because he can't live without an ACL. He can't live without play. So the other unfortunate thing is it's going to be expensive, and the other thing that's going to be even worse is that he's going to take at least 1 year off of football. At least it's not ending his football career. He still has a lot of high school and a lot of college to play. We plan on doing, and this is not going to end his career, but it will end the season. So that's the update, what the MRI is for. So that's the complete obliteration of the ACL.